Hello friends, today we are going to talk about the root canal, the most common dental treatment. Have you suffered from a severe dental pain? Do you have a sensitivity to hot and cold? If yes, then there is a one solution, that is the root canal treatment. Are the root canals are really painful? You must have heard the experiences from your friends, families. I went to the dentist and the root canal was really painful. Good luck for your root canal. Have you heard all these things? Today we are going to discuss in detail about the root canal treatment. But before that, first let us understand the anatomy of the tooth. Okay? The tooth consists of three layers. The outer layer is enamel, the middle layer is a dentine, and the innermost layer, that is a pulp. The pulp tissue which contains blood vessels, nerves. As you know, the nerve carries the sensation of the pain towards the brain. So when you have a small cavity which involves the enamel, that is an outer part, you will not have any pain or sensitivity. If the cavity goes deep and involve the dentine, then you might have a slight sensitivity to hot and cold. But when the cavity reaches to the pulp tissue, you usually have a severe pain. So what is the treatment? What exactly we do in the root canal? When the patient visits to our center, first we go through the thorough examination. Which exactly tooth is hurting? Then we take some x-rays for the investigation purpose. Once we know that exact tooth which is hurting, we give and administer the local anesthetic solution. That is too in a minimal painless way. Once we achieve the complete anesthesia in and around the tooth, we isolate the tooth with a rubber dam. After the rubber dam, there is no saliva incorporated into the cavity. The tooth becomes completely isolated, and with the help of the microscope, we usually see the tooth in a magnification. The microscope has its advantages. You can clearly see and locate the canals within the tooth. Okay, so after administration of the local anesthesia and isolation, we start cleaning the cavity. Then we remove the decayed part from the tooth, we reach till the nerve, and then we locate the canals. Once the canals are located, they are cleaned with the rotary instruments. We reach exactly till the end of the root. We remove all the nerve tissue, clean it thoroughly, disinfect completely, and with a biocompatible inert material, we fill the tooth permanently. That's it. That is the root canal treatment. Does it sound painful? No, it is not painful at all. After doing 5,000 root canal treatments, I can assure you, we do a most painless treatments in our practice. Okay, so what precautions to take after the root canal? Because we have administered local anesthetic injection, that area surrounding the tooth, lips, cheeks, tongue, all these are numb, they are anesthetized. The effect of anesthesia lasts for next 2 to 3 hours. So we ask the patient not to bite anything for next 2 to 3 hours, because you might land up into biting your cheek, lip or tongue, which may lead to the ulceration. Second thing, we ask the patient not to eat from that side for a few days, because we have removed the nerve from the canal. Because once we remove the nerve, there is always a slight injury below the root. If the patient bites from that side, the pressure goes from the tooth onto that injury and it may hurt. So we ask the patient not to eat from that side. Last, follow the medications. We usually prescribe only analgesics, and if required, some antibiotics. We ask the patient to take those medications and follow visit is scheduled after 4-5 days. That's it. Your pain is gone. The tooth is saved. And that's how we do the root canal at our microscope enhanced endodontic center. For details, you can visit our website microdentdentistry.com, or for an appointment, you can call 726 448 000. Thank you.